So this is focused ultrasound, and the idea is that there are a number of disorders, for example, tremor or Parkinson's or even certain types of epilepsy that are caused by abnormal electrical activity, neural activity in the brain, and can be treated by reducing activity or modulating activity in a specific way. This instrument is taking the mechanical energy of ultrasound and focusing it on a specific spot in the brain, the size of maybe a pea, and creating an intentional small area of damage that settles down the abnormal electrical activity in the brain without having to make any incisions, without having to administer really any anesthesia to treat the particular disorder. We see the improvement in tremor in these patients during the procedure. So it's in real time, it occurs as we're doing the procedure over that 1 hour or so. And then it should last for many months and hopefully years. I remember vividly meeting Mr. Durkee late last summer, successful practicing lawyer, but quite limited by this tremor that he has in his dominant hand.
I've noticed symptoms probably for more than 15 years. I was diagnosed by my family physician and we tried some beta, and that didn't do much good. So I knew that there was an ultrasound procedure that had been talked about, a non-invasive procedure, and just started tracking it on the web. And then I noticed that Baylor was doing it. All right, the Baylor's different. That was somebody I could trust. So I reached out to Baylor and made an appointment with them.
Well, the procedure went very well. We did all the setup scans. Then as we started doing those sonications, those delivery of the focused ultrasound energy, with each successive delivery, we saw the tremor get better and better. And I remember having him draw the spirals, which were initially extremely shaky. And then by the third or fourth one, it was extremely smooth. His handwriting was legible. The patients are wide awake during this procedure. So he's commenting to us about how much more control he has over his hand and how he can actually read his handwriting.
When they were actually doing the sound, well, you don't feel a thing. You don't feel anything. They'd come back and they'd check me a little bit. All right, that's a little better. We'll do a little more. But then at the end, when they checked me out, it was 100% immediate difference.
And then afterwards, of course, seeing him in follow-up, this benefit has been sustained, and he's enjoying all the benefits of it in terms of being able to have legible handwriting and not having to be embarrassed when he goes out to dinner and needs to eat soup with a spoon.
I didn't notice any transition over time of it getting better because it was already fine. It is certainly something that ought to be considered if you are dealing with this issue.
The instrument is still an expensive instrument. It requires a lot of scientific and technical know-how. So as we get better and better at doing it, hopefully more centers will be able to acquire these installations and start using this therapy for more patients. As it becomes more available, it's already covered by insurance, so that's a big barrier that we've already overcome. But as the awareness increases, patients will seek it out. As patients seek it out, more centers will adopt it. And as they do, there'll be more and more ways of delivering it. We have one system right now. There'll be other systems in the future. We're using it for 1 or 2 disorders right now. We'll be using them for a dozen in a few years, I'm sure. This is standard of care. This is not experimental. This is something that we can do now. It's FDA approved. It's being done by a number of clinical sites. And let's find the right application, the right procedure for each individual patient.
Just based on how I feel and how things are going and whatnot, I'm not getting any younger, but this does not appear to be deteriorating to any extent. It's not a temporary. I know there's a time limit to how long they can have this do well, but I feel I'm going to be all right for quite a while.